Okay, let's talk about ovarian cancer. I know, it's a topic that can feel heavy, even scary, but we're going to cut through all the confusion and the myths today. The goal here is to give you clear, straightforward information so you can understand your body and feel empowered to speak up for your own health. All right, let's jump right in.
You've probably heard this phrase before, the silent killer. For decades, that's been the nickname for ovarian cancer, and it's a terrifying one, right? It makes you think that there are no signs, no warnings, until it's just too late. And for a long, long time, that's what pretty much everyone believed.
But what if I told you that whole idea is just not right? Turns out, modern research shows us something completely different. A whopping 90% of people with ovarian cancer actually do have symptoms, even in the very early stages. The problem isn't silence. The problem is that we haven't been taught what to listen for. It's like our bodies are speaking a language we just don't understand yet.
So let's officially bust that silent killer myth right now. The real key to catching this early isn't waiting for some huge 5-alarm fire. It's about learning how to tune in and hear your body's quieter signals, the little whispers.
So if these signs are there, why are they so easy to miss? Well, it's because they are masters of disguise. They look and feel just like everyday life. You know, that bloating? Oh, it must have been something I ate. That pelvic pressure? My period must be coming. And it's that exact overlap that makes these early clues so sneaky.
Okay, so we've debunked the myth. Now let's get to the important part, arming you with the facts. Because honestly, the most powerful tool you have in your corner is knowing exactly what your body might be trying to tell you.
All right, so what are these whispers we're talking about? What should you actually be on the lookout for? Let's break down the key symptoms you really need to know.
First up is bloating. And listen, I'm not talking about the kind of bloating that comes and goes after a big holiday dinner. The key word here is persistent. It's a feeling of fullness or pressure that just sticks around, day after day. The kind that makes your clothes feel tight for no good reason.
Next, let's talk about pelvic or abdominal discomfort. This isn't always a sharp, sudden pain. A lot of the time, it's more like a dull ache or just a constant feeling of pressure down there in your lower belly. And yeah, it's so easy to just dismiss it as indigestion or period cramps, but if it doesn't go away, it's a really crucial sign.
Here's a really interesting one, your appetite. Have you ever sat down for a meal and you feel totally stuffed after just a few bites? Or maybe you've just lost your appetite altogether. That's a really significant change, and it's definitely something you want to pay attention to.
And finally, changes in your bathroom habits, specifically with urination. This could mean you feel like you have to go all the time, or you get that sudden, intense urgency where you've got to go right now. The important thing here is any noticeable shift from what's normal for you.
Okay, let's pull all that together in a quick checklist. The 4 main symptoms to really watch for are that persistent bloating, the pelvic discomfort, feeling full too quickly, and those urinary changes. But also keep an eye out for other things, like new constipation that just won't quit, any unusual discharge, or, and this is a big one, any vaginal bleeding at all after menopause. Think of these as a cluster of signs to keep on your radar. So, knowing the symptoms is step 1. But since they can be so vague, here's the million-dollar question. How do you know when it's actually time to call a doctor? This next part is absolutely critical. It's the bridge between just being aware and actually taking action.
Here's a really simple rule of thumb. It's time to see a doctor when your symptoms are frequent, persistent, and new to you. That's it. That's your 3-part checklist. This is what separates just a random off day from a pattern that you really need to get checked out.
And when we say frequent, it's not just a vague feeling. There's a specific guideline here. If you're experiencing any of these symptoms more than 12 times in a single month, that number is your signal. That's the point where you stop wondering and you start a conversation with your healthcare provider.
It's also really important to know that these symptoms can change over time, and that's exactly why acting early is so critical, because the signs can become much more severe as the disease progresses. Let's just take a look at the difference.
So in those early stages, you have the whispers we've been talking about, right? The mild bloating, the pelvic pressure, stuff that's pretty easy to ignore. But in the later stages, those whispers can become shouts. We're talking about things like severe back pain, unexplained weight loss, serious fatigue. And this progression is exactly why catching those whispers early is so incredibly vital. Okay, so you've listened to your body, you've noticed a pattern, and you've made the appointment. Now for the final crucial step, knowing how to advocate for yourself. Let's make sure you walk into that doctor's office feeling prepared and totally empowered. When you go to your appointment, go prepared to ask direct questions. Be brave enough to actually say the words, "Could my symptoms be related to ovarian cancer?" Ask about what specific test might help. Ask about your personal risk factors. And always end with, "So, what are the next steps?" This is how you go from being a passive patient to being an active partner in your own healthcare.
For way too long, we've been told to wait for our bodies to shout at us. But the reality is, they almost always start with a whisper. So I'll just leave you with this thought. Could learning to listen for those whispers and having the courage to act on them be the thing that saves your life?